Dr. Hakan has two passions in his professional life: to provide state-of-the-art care for multiple myeloma and lymphoma patients, and to teach medical students and residents. He is a fellowship-trained transplant physician who's worked at Cancer Care Northwest since 2004. Dr. Kaya is the director of the Inland Northwest Myeloma, Lymphoma, and Transplant Program. In addition to performing autologous stem cell transplantation, he provides the latest treatment options for myeloma and lymphoma patients who live in eastern Washington, northern Idaho, and western Montana. He frequently gives lectures to other oncologists around the country describing new advances in multiple myeloma. Dr. Kaya is a clinical professor at Washington State University Elson S. Floyd College of Medicine, where he co-chairs the Hematology Oncology Course Committee. He's been charged with developing and teaching the Hematology Oncology course in this newly opened medical school. He's also been an active clinical faculty member at the University of Washington School of Medicine Spokane campus since 2004. And he gives regular didactic lectures and provides clinical rotations for residents and medical students. Outside of work, Dr. Kaya spends most of his time with his family. He also enjoys practicing martial arts. He is a World Taekwondo Federation certified first degree black belt, which helps him to cope with the daily stresses of being a cancer doctor.
Thank you.
Thank you.
Well, she's really good. She made this reservation a year ahead. So thanks so much for taking the time to come over here to listen to us. I'm not going to say anything about myself because you already heard, but I want to know who is here. So by raising hands, can you tell me who are the cancer patients? Well, who are the others? No, they're not. My skull was fractured and my face was all messed up. And I was in the intensive care unit for 2.5 weeks. They told my wife that I'm not going to recover. There's no way. I was paralyzed. I was transferred to the regular part of the hospital where I spent another 45 days. I remember the nursing care. They held my hand, they fed me, they took me to the restroom. After 45 days, they took me to the rehab center, which is the next building. And one of the nurses came. She said, hey, this is your first day, so how's it going? Are you comfortable here? I said, I'm okay, but I don't think these patients like me very much. She said, why do you say so? Because they're not talking to me. I'm asking them questions, they're not answering. She said, they cannot talk, they're all brain injured. So, okay. So she left. I'm like, oh my gosh, I'm here too. So I'm like one of them. So I'm like, okay, well, if they cannot talk, how come I'm talking? I'm asking myself, well, I'm talking maybe, but I have other things going on. I'm like, oh my God, it's like a nightmare. So it's like a nightmare. So I'm over there in this unit, so I'm looking at the ceiling. Oh my God, I'm 32 years old at that time. I'm 48 now. So I'm like, oh, I'm a young guy with a 4-year-old daughter and a wife. What's going to happen to me? Where am I? I'm like, it's like a nightmare. The neurologist comes, and then he says, I have to be honest with you. You're a doctor too, so you will never be able to practice medicine. I'm like, he said, my goal, and his goal was for the next 3-4 weeks, my goal is to get you to a point that you can do your self-care. You can take a shower, you can shave, comb your hair, you can do those kind of things. That's my goal. And then he left. So my goals did not match with his goals. And my goals, I'm 32, I just want to get out of there and just have my wife and daughter go to Spokane and have a practice. He says, I cannot do that. It is so important to have a loving family member or a friend that helps you through this journey. So I'm grateful for my wife and daughter with their loving care. And then when I went home, I still continued to have rehab as an outpatient. Every day, my wife will drive me. And then a few months later, I got better, just by miracle. I'm just got better. And there was only one little problem. I was well, except for my right arm. I had a radial nerve palsy. My radial nerve was cut from here. So my hand was like this. So I could not really lift my wrist. It was like this. I'm right-handed. So I called them. It was in February. I said, look, hey, I may be able to go there in a few months, but is there anybody else who can do bone marrow biopsies? They said, no. Met with my mentor, Dr. David Hurd again. Dr. Hurd, I need some help here. I need to learn how to do bone marrow with my left hand. But in 2 months, they taught me how to do bone marrow with my left hand. We moved to Spokane. Just a week before I start the VA, I got up in the morning, as usual. I'm just going to do my routine. So I got up. It was back. So I did not have to do it was really back. So I was like 2 hands suddenly. Like a week before I started the VA. So I'm great, okay, perfect. I'm just normal now again. Well, then I started the VA. I had a really experienced nurse at Spokane VA, Darla. She had been there forever. I'm this 32-year-old young guy. So I'm going to do my first bone marrow biopsy a week or 2 later after I started. Darla said, Doc, you look kind of young. Do you think you can do this? I said, Darla, I'm so good. I can do it with my right hand, left hand. I can turn, do it with my eyes. I can do everything. Really, really sick. I think hopefully this will, I told you this story, hopefully now you'll take me more seriously when I say I understand what you're going through. So there are things that I remember from my ill days that I'm gonna share a couple sentences with you. If you agree with that sentence, or if you felt that way, I want you to clap. If you don't agree, I'll say ooh. Okay. So this is how those things I remember. Sentences. Gosh, I am so tired. Am I ever gonna feel normal? Am I ever gonna feel better? Okay. All right. That was an easy one. That was an easy one. Okay. Am I gonna die? Am I gonna be able to see my children or grandchildren growing? What comes to your mind? Okay. How about for the caregivers? It's really difficult to be a caregiver because patients have a lot of support. They have their doctors and nurses and you, but you have no support at all. You're just by yourself. So that's really tough. So whenever I have a patient, I try to support the caregivers as well. It's a really tough job. So I think we should say thank you to the caregivers here. And I want to thank my wife and daughter. They're traveling. They're not here today, but I want to thank them too in this occasion because whatever my wife does from now on, I can never say anything because I owe her so much that she's good for a lifetime. Okay. Well, before this talk, I asked Nicole, I said, what do you want me to talk? And Nicole said, she's been working with the cancer patient for years now. She said she hears from the cancer patients sometimes that they go and talk to their oncologist about the treatment, but they are sometimes under the impression that they're really not asked what their opinion is. I'll tell you a scenario in a patient's room, and if you do not agree, I want you to clap this time. And if you think it is silly, I want you to clap. And you can yell out silly if you want to. Okay, you're a patient's in a doctor's room, an oncologist, and patient's cancer is progressing, and the doctor says, well, ma'am, your cancer is progressing. There are 3 drugs we can use, drug A, B, C. According to literature, they work about the same. You've been taking some of them in the past. There are 3. I think I want to give you this one. We'll just do this one. All right, well, I'll make your appointment. At the same time, the patient is thinking, gosh, that drug A, that's the drug that made me really sick last year. I had so much nausea, vomiting. I was so sick. I don't want to do that again. But if I tell this to my doctor, he'll probably upset. He may not treat me right. Maybe I shouldn't say anything. No, maybe I'm not going to say anything. And then, well, okay. She gets all the strength and says, doctor, I had that drug last year. It made me sick. Doctor goes, no, here are the potential side effects in the literature. This doesn't have a side effect like this. It doesn't. It just doesn't. There's a whole list of side effects, but it's not one of them. So I insist that we take one of this. But I'm kind of in a hurry. I have another patient waiting for me right now anyway, so let's just go ahead and get to the next patient. I'll schedule for chemotherapy next week. So if you disagree with this, say something. If you think this is no good, say no good or something like that. I think. So okay, how about this scenario? The same thing. For example, Chris is the patient, and Dr. Chris says there's A, B, and C. Well, I recommend A, and then Chris knows he had side effects from this. He gets all upset. He just gets up and says, Doctor, you don't know what you're talking about, buddy. I don't want to do this. You're a terrible doctor. I'm out of here. I'm just going to get another doctor. I'm out. Well, this is not the way either, right? So you have to say something. Say it nicely. Say it like in a different way. I think so. That's my teaching comes right now as an oncologist and a previous patient. So anytime when your doctor gives you options, sometimes we doctors, we don't think about, we think, okay, there are 3 options. This is the best in my opinion. But sometimes we forget to ask the patient, discuss in details. So I think when the patient tells you, when the physician tells you, I'll recommend that drug A, and you say, well, I have a lot of side effects. You can just say, oh, doctor, thank you so much for your care. Thank you so much for trying to take care of me. I just want to remind you that this was the drug that made me really sick. Could you tell me about the second drug a little bit more? Or is there a big disadvantage taking the drug B over drug A? More than likely, the doctor will say, no, there's no disadvantage. I just picked drug A. because a new drug, I want to get more experience myself, or no, or say I just thought this was the best one for you. But so I think the best thing when they give you options, first of all, get all your options. So what are my options, doctor? What are the potential side effects? What are the benefits? Write them down. It is really helpful if you take a family member with you or a friend, because they take notes for you. As patients, I remember my patient days. We don't know. We're kind of little things are cloudy. We don't remember everything. So it's best to have a family member or a friend take notes for you. Get all your options. And then instead of arguing with the doctor, just, hey, what are the advantages, disadvantages, this and this? And I say, can we just talk about this a little later? Let me go home and think about it. And then, because yes, physician, oncologist wants your best interest, but they don't know you that well. You are the expert on personal values, as you said. So you are the expert of yourself. So you need to go home, think about those things. And believe me, we doctors, we will not get upset if you say it nicely. If you behave like Chris, I'll be upset. We go way back, so we know each other. So I'm going to pick on him. Oh, Chris, doctor will be okay. We'll say, fine, yeah, let's talk about those options. Okay, that's scenario number one. Let's talk about another oncologist scenario. An older patient, 88 years old, 89 years old patient, goes there to the medical oncologist with an incurable kind of cancer. Medical oncologist says, gosh, ma'am, your cancer has progressed. I think I want to give you more chemotherapy to kill your cancer so you can gain some more time. Let's set you up for this heavy chemotherapy tomorrow morning. And then this 89-year-old poor lady, she's like, well, I'm not sure in her mind, because she's not able to tell their doctors. She was raised in a way that you don't talk to the doctor like that. She's like, well, gosh, I'm 89. I had so much chemotherapy. They tell me I'm going to lose my life soon, but I don't want to lose my life miserably. Maybe I don't want any chemotherapy. I don't know. Maybe I should say something to the doctor. The doctor say, okay, ma'am, I'll set you up for chemotherapy tomorrow morning, 8 o'clock. We'll go from there. And the patient goes, okay. Well, if there was a family member right there, and we'll probably say, hold on, doctor. Can we just have a minute here? Thank you so, again, not like Chris. Not like shouting, yelling. So very nicely, doctor, thank you so much for taking care of my mom. You've been great all along. But my mom is 89 years old. You're telling us that she's got only a year left with her cancer, with incurable cancer. And you're telling me that this chemotherapy may gain her a few more months. But gosh, if she's going to be sick the whole time for a year, she probably prefers not to have the chemotherapy and want to spend some time with me and my children and her grandchildren. Is that an option too? Most oncologists will say, yes, it's an option, of course. Yeah, we can get hospice care, we can have nurse help. It looks like he or she is in a hurry. Doctor, it looks like it's a busy day for you, but I really want to spend a lot of time about the plans for my mom. Can we make another appointment? Can we come and see you a week from today? What is the best time for it? Like end of the day, 4 o'clock. We really want to talk about this because this is so important. We're talking about your mother's next year. Either she's going to be vomiting all day, every day, versus you're going to spend time with the grandchildren. Or maybe there's an easier option. So as medical oncologists, we just need to be reminded of those things because we don't know. You are the expert of your own body. And sometimes, if for example, if that daughter was not there, the patient, because they don't want to upset their doctor, they don't tell about how they feel. In fact, I know a lot of patients, even if they feel terrible at home, they come to see us all dressed, they're feeling well. I'm fine. How are you? I'm fine. I have to remind them, I said, Mr. Jones, this is not a social asking. I'm just saying, how are you really? Oh, okay, well, I'm actually just having terrible pain. My neuropathy is bad. I've been vomiting all night. So no, so some patients, they don't want to say this. So you need to be honest with your doctors and family and friends. They need to ask for other options. Very, very important. Nicole also told me that she has met with patients that they felt that their doctor was not a great match for them. This is a great medical community in Spokane. We have all the great doctors, but sometimes it's not a good match. For example, Chris and I may not be a good match. She comes. For example, he comes to the. You go see an oncologist for the first time. Well, looks like a nice guy, well trained, talking nice and everything, but it may just not be the right fit. So in that situation, a lot of people feel uncomfortable for switching to a different doctor. There is nothing wrong with this. I did that myself in the past, many years. I helped my wife to change her dermatologist or other doctors. If you're not a good match, you have to change, because as a cancer patient, you already have a lot of problems that you have to put up with. Gosh, you have cancer, you have this and this. You don't want to deal with somebody you don't even like that much. And also second opinions. We doctors we actually support second opinion. Great, just go there. Then I will know if I'm doing the right thing, if there are some other suggestions. So we will always support second opinions. So if you want a second opinion, always ask your doctor. If your doctor is not supporting that, gosh, you need to get a different doctor anyway, I think. Nothing wrong with getting second opinions from the same practice, from different practices, from university. We were here for a year and a half. I came home one day. My daughter was 6 or 7, I think, that day. So I came home, and my daughter said, "Daddy, we want to talk to you." She looked very serious. I'm like, ooh. So I pulled a chair. She said, "Daddy, Mom and I decided to stay in Spokane." Okay, I said, "How about me?" She's like, "Well, would you like to stay too?" I said, "Yeah." I said, "Yes, but I'm a transplant doctor. I don't see a transplant program here." And then my wife said the magic words: "If there's not one, make one." And here we are. That's why all these patients are here, because they all had transplants in Spokane. That's the final story. But now we have 20 minutes. This was just an introduction. I really would like to answer questions about patient self-advocacy. How can you help yourself when you go to a doctor's office? Because are you feeling that it's a rushed visit, the doctor is in a hurry looking at his watch all the time, and there's somebody waiting outside let me give you an example. I talk too fast. This is my best. Imagine I talk too fast. When I talk Turkish at home, my wife said, "I feel sorry for your patient because you talk too fast." She doesn't understand me talking. So I talk too fast. It has happened a few times. I'm talking to a patient. The patient says, "Dr. Kaya, would you please slow down? I don't understand you." I welcome this. I really welcome. This is much better than my nurse, Ida, telling me the next day, "Remember the older patient you saw yesterday? She said she didn't understand a word you said." So really, give feedback to your doctor. Maybe doctor may be a soft-spoken, easy-spoken guy, but they may not explain the things in a lay person language. They may just talk too medical. You may not know. So what I'm trying to say is, if you don't understand your options, ask, because he or she is the best one to ask. So you go there, and you have cancer. These are the options. Well, tell them, "Doctor, thank you for your time, but I'm really not sure about my options again. Let's go over them again. Here's a pen and paper. Option 1, 2, 3. What are the benefits? How much benefit? How much side effect? How am I going to feel with this drug?" Really, really important. And if the doctor looks like he is in a hurry, make another appointment. This is important. This is so important. Make another appointment. And then make a 1-hour appointment. And then say, "I'm going to come back. Doctor, I'm going to come back for this again, but let's talk in detail. Please tell me more." That's our job. We have to tell you everything. And also ask the nurse, when you go home, if you have questions, is there a way to be able to get your questions answered? Sometimes you try to call, doctors are busy, they cannot talk to you. But there are nurses, they welcome emailing. You email the nurse shows that email to the doctor, and doctor reads them, okay. And actually, I ask my patients sometimes do that before the visit. They send me a long email with all the questions. So I'm prepared. Because there may be some difficult questions, I have to Google them. No. But seriously, I have several patients, they send me a long email about their questions. I look at them and I try to address them during the visit. Because if I don't address them, they're going to leave unsatisfied. They're not going to be happy. So it is important for you to really get the message. Sometimes as doctors, we don't know. Now, if you ask doctors, 9 out of 10 will say, "Oh, I answer all the questions for my patients." You ask 10 patients, 9 out of 10 will say, "No, he didn't say a word." That's why tell them. Tell the doctor that, "Please answer my question because I did not understand what you just said." If you want a second opinion, you should seek for second opinions. It's okay to switch doctors. It's okay to ask questions. If you're not going to ask the question, who's going to ask for you if you don't have your family there? So very, very important. So be your patient, be your best advocate, really. Anything else? Yes?
I thought it was interesting. My husband, we both had cancer. He had colon cancer. And at one point, they were putting him on a new drug.
Yes.
And he actually read the stuff that comes with the drug. you know,
Yes.
the I don't know how many pages of side
Yes,
effects,
sure.
the results of the trials, all that kind of stuff. And he came back and he told his doctor he wasn't going to do it. And the doctor was great, but he said, "You actually read that?" And the implication was that most patients don't actually read
Sure.
the literature that comes with, that they can get, that comes with the drugs.
When you look at the package insert, there are hundreds of potential side effects. So your doctor may tell you what are the most common ones. So yes, you can still get information from other sources, but it's really dangerous to Google things and look at things. So you need to ask your doctor, thank you for the information I'm going to take home to read, but what is your experience? What are the most common ones? What we tell our patients, if you're receiving active chemotherapy, we like you to call us for everything. Because if you're getting active chemotherapy, we see you every month or every few weeks anyway, and the symptoms may be from the chemotherapy. On the other hand, if you had chemotherapy for a few years ago, we're only seeing you like once or twice a year, you should call your primary care doctor for a common cold and things like that. But active chemotherapy, always oncologist.
Just wondered if that was one of the ways to save time for oncologists.
If you call the primary care doctor, they will call us anyway.
Oh,
Because you're on active chemotherapy, because it may be the side effects of the chemotherapy. So active chemotherapy, call your doctor. No active chemotherapy, don't call them. You can always call them if you think it's a cancer-related to something.
Right.
Dr. Kaya, thank
Thank
you
you.
so much. Really was.
Did I talk too
think-
fast?
I felt you did pretty well. I could understand you. Yes. We just have a small token of our
Oh, thank you.
appreciation for. It's like, see, this is falling apart in here, right?
It's all in gold. Oh gosh, you didn't have to do that.
All in gold. So just those of you that have been in sessions, you've been seeing these boxes go to presenters, and this just essentially has the LiveStrong manifesto, a bit of a statement about the LiveStrong at the YMCA program and
Great, I'll
why
provide
we
my-
do that.
my office wall.
And a quote from one of our participants, who happens to be in the room, and I found out it is her birthday today.
Oh, wow.
So happy birthday, Debbie.
Thank you. Thank you. Thanks, John. Thank you. Thanks so much.
Thank you very